member for Calgary-Alba.
Thank you very much, Madam Speaker, and I really want to say to the member for Calgary Southeast, thank you for your passion. Thank you for your service as a first responder. You're a braver man than I for doing what you do. And as you're speaking, I'm just reflecting that I, as a father of a junior high aged daughter and another daughter who's younger but will soon join her sister in junior high, I think about our life and the life that we have in our household, and I think, well, my daughters can't possibly be at risk. We love them very much. They're safe at home. They're well fed. They're not abused. They don't see addiction at home. But of course they're at risk. Of course they are. Every single one of our children are at risk. All of our neighbors are at risk. And we as individuals are at risk as well. None of us are immune from this. And I think the story that the member for Calgary Southeast told really brings that home. And what also brings that home are the people who have joined us here today, some of whom who spoke this morning at our news conference, others who joined our news conference, like the father who lost his daughter just last November to a fentanyl overdose. She was loved. She was supported by her family, and she looked like a normal, ordinary teenager. She was a big sister, she was a granddaughter, she was a friend. But she's lost to us because of an accidental fentanyl overdose at age 19. And we were joined this morning also by Rosalind Davis, who's here today now, who lost her spouse, Nathan Huggins Rosenthal, to an accidental fentanyl overdose. She became addicted to after being prescribed opiates in response to a back injury. But they sought treatment. They had the means to seek private treatment. And Nathan, for a time, was clean and sober. But he relapsed, which is something I've learned is tragically common. I've come to understand that an addict will relapse up to 7 times before getting clean permanently. It's not simply a matter of saying, well, just please stop, just quit cold turkey, especially with opioids. It's far more complicated than that. But Nathan and the 19-year-old daughter, it's a common story. It's not just people who are street involved. Every single one of these people and every single one of these lives has their own story. There is no such thing as a typical, quote, opiate addict. There have been too many deaths in this province, far too many deaths in this province. And there has not been enough coordination and not enough sense of urgency from this government to stop this epidemic. And I'd ask this minister, who I know to be a compassionate person, to listen to your heart, to not just listen to the technical arguments that you may be hearing from your department. It's important that we use all of the tools at our disposal. It's important that naloxone is made available, as it has been, but it's nothing more than a Band-Aid. People will die alone, and that happens in suburban Alberta, it happens in small-town Alberta, it happens in dense urban areas. But naloxone cannot be the only solution. We need more inpatient treatment for people who finally choose to seek help. We need more outpatient treatment for people who finally seek help, want to continue and are appropriately able to continue on about their lives and don't require inpatient treatment. We do need supervised consumption sites. That can't be the only answer, but it needs to be part of the solution. We need opiate replacement therapy, and we need to declare a public health emergency. Now, declaring a public health emergency is not just some symbolic act. It gives, and I quote from the Public Health Act, quote, allowing for, quote, the prompt coordination of action required in order to avert or minimize the pandemic. What we're dealing with here is a pandemic. It is an epidemic that is rampaging through not just our streets, but our neighborhoods, our homes, our communities. Further quoting from the Public Health Act, declaring a public health emergency also, quote, provides for the distribution of essential health and medical supplies and provides and maintain and coordinate the delivery of services. And I want to emphasize the importance of that word, coordinate. A public health emergency would provide focused leadership. It would provide a sense of urgency, and it would allow for the coordination of efforts between departments. Now, I know various departments of this government have a plan. I know the Department of Health has a plan. The Department of Justice has a plan. Community and Social Services has a plan. Education has a plan. Indigenous Relations has a plan. But I've seen scarce, if any, evidence of coordination within and between those departments of their plans. We need a public health emergency to bring focus to this issue. Any large organization has challenges working within and between departments. But for something like this, we cannot afford to have different departments working at cross purposes. We need to use all of the tools in the toolbox. We need to use every tool at our disposal. There's no reason not to. In fact, there's tragic consequences if we don't. Now, there have been some objections raised to the fact that a public health emergency would expire after only 30 days. That's true, but it does not prevent the minister from renewing that should she decide it is required to be longer. And the other question that's been asked is, well, when do we know that this public health emergency is over? It's not a typical, obvious, contagious disease, influenza or other, where we would know it's over. Well, the answer is, it's over when the rate of deaths from opiates, fentanyl, carfentanil, others, drops back to its long-term average. Right now, we've seen the graph, it just is a hockey stick. It goes through the roof. It is literally off the charts. That is an emergency. It is a crisis. And Madam Minister, there is no shame in now declaring a public health emergency. We all would have liked to see that done months or even years ago. It should have been done sooner, but it wasn't. But it still can be. It still can be to the benefit of people who are struggling with opiate addictions now, to the benefit of their families who will not lose those people to opiate addiction. And I can assure you that every single member in this House will thank the government for doing so. There will be no "we told you so." There will be no gloating. It will be an acceptance that it's the right thing to do. I will be the first to congratulate the government, to praise them publicly, and to thank them for taking this important step. It's not too late, Minister. I please urge you to declare a public health emergency. Thank you.